So wound healing, scar revision. We are cosmetic surgeons, so we are not so often exposed to wound healing problems, but we do get patients coming to us for scar correction and contour defects. This is a picture of a 16-year-old who had a deglovement trauma in her childhood. And so we did 2 sessions of microfat grafting, but on top of that, we injected nanofat in this pigmented area. And apart from clear improvement of the contour, you see that also the quality of the skin has improved and the pigmentation has become less pronounced. We have already shown this patient, so she came to us. She was initially treated with hyaluronic acid in her cheeks. The left cheek got infected with purulent infection for a long time. Afterwards, she underwent thermage treatments with the idea of lifting her face, which hasn't worked, which basically only has increased the fat atrophy in her face. So you see all the areas that we have treated with microfat, but obviously her scar was treated with a combination of deep microfat to fill up the contour defect, then sniff into the rhytid itself, and then the area was treated with nanofat. And I don't think there are many other ways to treat this kind of problem and to obtain such a result. The 70-year-old patient came to us for a facial rejuvenation. He had a scar on his right cheek, which he actually he wasn't bothered with it, but Patrick injected it with nanofat and with sniff, and actually without counseling the patient. And he was a little bit upset that he had lost his scar because he thought it was a pretty manly thing to have, a bit of a macho thing. But this is, well, we cannot turn it back. We can give him a new scar, of course. But this is the 1-year post-op result. So the scar has virtually disappeared. And I think this is the first time in history that we can tell patients, yes, we can make your scar disappear. Before we had to say, okay, we can relocate it, we can change the direction, so and so and so. But this is really changing the whole appearance. This lady underwent a facial blunt trauma. A few years before that, she fell with her bicycle. And as you know, sometimes a blunt trauma causes an atrophy of the subcutaneous fat. So this is, again, the result after a combination of microfat to fill up the contour defect, sniff into the dermal aspect or the dermal portion of the scar, and then nanofat to improve the surface. And again, I think this is what we can call really scar correction. This has disappeared. Now, this is a disaster that was referred to us by another surgeon who, had absolutely no clue how to treat this lady. So she had a facelift and she had bad skin necrosis of her skin flap. So we waited until the eschar fell off. We treated it locally, but then we started injecting nanofat in the eschars, and we repeated this 4 times with an interval of 2 weeks. And so this is the result that we could obtain after 6 months. Then she went back into the community, and obviously she has not an ideal facelift result, but at least she can function, and with some concealer she can absolutely deny that she had this terrible complication. This is another example of what you can achieve on the pigmentation. So this is a depigmented scar after a motorcycle exhaust burn, which not only has caused a hyperpigmentation around the scar, but also you see this hypertrophic portion in the center of the scar. So this has been treated only with one session of Nanofat, and with a result of a definite improvement of the scar quality, the skin quality, and also a decrease of the pigmentation. Patrick has already shown you this young lady. She had 2 treatments with intradermal microfat and subcision of the dish-like scars and Nanofat over the whole area. And so that's the aspect that we could obtain after 2 years. So the Nanofat cream is something which we use in a post-op session, but we also use it after resurfacing. And so we have seen that the healing of the resurfacing areas is at least 20 to 30% quicker. And we are studying now the effect of this Nanofat cream on donor sites of split thickness skin grafts, because these are consistent in thickness or depth, and so we can nicely compare the effect. We have also treated stretch marks, and the remarkable thing with stretch marks is that although that they don't give a very obvious improvement on photo, all of the patients report that the stretch marks feel much more even, they feel softer, they don't feel as atrophic. So this is something that we further need to investigate, I think, by biopsies to see what happens in the dermis and what's happening with the collagen and the elastin content. So again, here I think that that Nanofat is a welcome adjunct in the healing of the skin surface trauma, but also old, completely stabilized scars can be improved with Nanofat, and it results in a true transformation of the scar. And I think this is really something new and very exciting. But as I said again, we need further investigation to unveil the mechanism actions of Nanofat. So this is my last speech for this meeting. I will have to catch a flight in the afternoon, so I won't be able to stay until the end. I thank you all for your attention and for your resilience to stay here, and I hope to see you in other meetings. Thank you very much.